Children illnesses and deaths has been an issue for a very long time in all parts of the world, but it is no secret that it's harder to access medical treatment in less developed countries. And due to ongoing climate change, limited access to treatment, and poor nutrition, a lot of the children in these less developed countries are prone to get illnesses, but they also have a harder time fighting it. Deaths in children has been a huge issue for a long time as well, and the number has gone down, but it is still a large number. And according to Solani Datani, Fiona Spooner, Hannah Ritchie, and Max Roser, child mortality is one of the world's largest problems. Around 6 million children under 15 die per year. A lot of things can cause these deaths. And according to the World Health Organization, some of those leading causes for children under 5 is preterm death complications, birth asphyxia or trauma, pneumonia, congenital abnormalities, diarrhea, malaria, and all of these can be prevented by vaccine or even medication given to them from a doctor. But because they don't have access to a lot of medical care, they cannot get these vaccines or medication to help prevent and fight these diseases. Another thing that affects the death and illness in children is poverty as a whole, but the main thing for poverty is the nutrition. And the nutrition just does not affect the children, but it also affects the women. And according to Jennifer S. Franz and Felix Fitzroy, poverty and nutrition also have an effect on fertility in women. Poor nutrition decreases the fertility in women, but if the women do get pregnant and they do carry a baby to term, it is even harder in those first 5 years to keep the baby alive and make sure that they're getting the nutrients and the resources they need to survive. In a study conducted by Mandana Arabi, Edward A. Frangio, Razmi Avula, Nune Mangzarayan, the patterns of the feeding in these countries were examined. And they found that breastfeeding, which a lot of studies have also shown that breastfeeding is vital for a baby's health, and if not breastfeeding, then making sure that there's some supplements to make sure these babies are getting the vitamins and the nutrients that they need. The vitamins and the nutrients that they need, it sets the tone for the way they grow and develop. And if they do not get the things that they need, then they will not develop the right way. Another thing, besides physical health, poverty also has taken a toll on people's mental health. And according to Olivier De Schutter, Hugh Fraser, and Catherine Gaillot, and Eric Marlier, poverty not only takes a toll on children's physical health, but it takes a toll on their mental health. The stress of not having access to resources and having to struggle to find where their next meal is coming from takes a toll on them. Another factor into how diseases is spread is the environment that's around them. If the environment is not taken care of, then the people cannot take care of themselves. And according to a study covered by Kelly F. Austin, Deforestation and Biodiversity Loss Association, associated with export flows, influence the number of malaria cases in less developed countries. So because of the deforestation and the trees being tear down, mosquitoes have to move, and they move to where people are, so more people are being infected with malaria. Another thing that happens in less developed countries, some of them have extreme weather and extreme natural disasters, And according to Rima Hanna and Paulina Olivia, even today, many developing countries experience a disproportionate share of extreme weather, and they are predicted to suffer disproportionately from the effects of the climate change in the future. Climate change will not get any better. It's either going to get worse or it's going to stay the same. So there has to be a change for the resources of the people in the less developed countries. That way they can adapt to the extreme weather changes that climate change is providing. Another issue in these less developed countries that is causing more deaths and illnesses in children is the healthcare in these less developed countries. There is still a lot of biases in these less developed countries, even though a lot of these people are sick. According to a study conducted by Kumar, the results show that there is limited access to health resources in less developed villages, in a less developed village, and that the amount of accessible healthcare varies depending on social groups and status. I feel like this is a problem everywhere because based on how much money you have or how popular you are or who you know, it kind of depends on how far people are going to go to make sure that you're healthy and okay. And another thing that is a big issue is the government and how they handle some crises. And according to Hamid Estrafari, poor control of diseases, which most are preventable, persists in many parts of the developing world because of the chronic shortage of resources, poor management, and lack of political will. So some of these governments just do not have the will to go out there and make sure that the doctors are doing what they're supposed to do and they have the resources that they're supposed to have. And this causes the doctors to run out. And sometimes the doctors are just not managed well. They are negligent and they are not properly trained. There's also many stories of the negligence by these healthcare providers in the less developed countries. And according to a book by Jody Hyman, Alita Sprague, Amy Raub, and King Modenik, there was a pregnant woman who went to the clinic whenever she found out she was pregnant to get tested for HIV, because that is a huge thing in Africa. And HIV is widespread in Africa. And she wanted to make sure that she didn't have HIV, that way there wasn't a risk of her passing it down to her baby. So she went to the hospital and got tested, but they never got back to her, so she thought everything was fine. Well, about a year down the road, she is noticing all these health issues with her baby. And come to find out that she was HIV positive and she didn't get the medication she needed to prevent the baby from getting HIV. So the baby was very sick and suffered tremendously. And that was due to the negligence of the healthcare providers at that clinic. They failed to pass on her test results. I don't know if it's because they're negligent or because they're not properly trained, but either way, a baby and a mother were very sick, even though they went out of their way to travel and to get the test that was needed. Illnesses and deaths in children in these less developed countries are a huge issue, and most of these illnesses and deaths are due to ongoing climate change, limited access to treatment, and poor nutrition.